Voices Network, which is a group of patient partners who really have come together, and we support to be engaged in the health system, whether it's around improvement projects, around system redesign. We do now have patients at the table, and our organization helps to foster that. So why define quality? Here in British Columbia, we have had a health quality matrix for a number of years, since 2009, and that original definition was built on work that had been done in some other provinces, as well as the OECD definition, the Institute of Medicine definition. But more recently, we started to reflect around our history here in British Columbia, and also around what the evidence was starting to say. So we know that there are definitions of quality that have been around for some time. And essentially, a definition outlines a number of dimensions that make up what quality is. So the Institute of Medicine and OECD, you can see really strong connection around their definitions and alignment to the dimensions that exist. It is about safety, it's about effectiveness, patient-centered care, timeliness or accessibility, efficiency, and equity. But when you start to dive into those definitions, we started to really think about whether or not they were reflecting what we believed quality to be. And so we reflected on two aspects. We looked at the latest evidence around what we knew was driving quality of care, but we also have been going through a period of reconciliation here in our country around honoring the history and teachings of Indigenous people. Here in Canada, many of us, the majority of the population, are settlers on the traditional lands of Indigenous people. And when settlers showed up here in our country, we did not treat Indigenous people with respect. We did not seek to understand the learning and teachings. Instead, we brought our own perspectives and put them on to Indigenous people who were here for thousands of years before before we showed up. And what has been happening here is just a reflection and understanding that we have much to learn from Indigenous people to honor what they have to teach us and the history of the land that we have here. And so we actually sought a process to work in partnership with Indigenous people here in British Columbia to reflect on how the history and teachings could be incorporated to how we define quality. And what was really interesting for us is, as we did that process and as we looked at the evidence in the literature, they were actually in alignment. And so we worked together to redefine quality, and that's what we wanted to talk to you about today, is to let you know how we have evolved each of those dimensions of quality, and then to give you some examples of how we're applying it within our own health system. So this is a visual view of our definition, and I will walk you through each of these perspectives. Our definition really has encompassed looking at health and wellness at the core. We have areas of care that we will walk you through, and then we have a number of dimensions. We do have 7 dimensions that make up our definition of quality. So a key change here, nature of care. Everything that we have exists in relationship with other things, whether it's with other people, whether it's the land that we are on, the environments that we are in. So as we explore quality now here, we are thinking about those relational aspects of the care and the interrelationship. So we are trying to embrace what I would say is the complexity that exists rather than trying to segment things out. We know, for example, that different dimensions of quality are related to one another as well. And so we're not just seeing them in isolation, which really comes from an Indigenous view around relationship and interrelationship. An Indigenous teaching would say that you could not understand a plant in terms of its segmented parts, like the leaves and the stems and its roots, and understand them as distinct parts of a plant, which is, I think, more of a Western view of a plant. But what Indigenous people will do is look at the plant, but what is near that plant? What is the soil? Is there a creek nearby? What are the other plants that exist near it? So we're trying to embrace that as we look. So what I'm going to do is walk you through each of these. 5 of the dimensions reflect the individual perspective and experience with care in the system, and then we have 2 system view lens, the equity and the efficiency components. So I'm going to start with respect. Many of you will have seen this dimension perhaps being called acceptability, perhaps being called patient-centered care. And what we really moved towards was this concept of respect, which is around honoring a person's choices, needs, and values. And we really reflected on respect as a core quality dimension, reflecting the dignity of a care experience and recognizing that there are power imbalances between providers and those who are receiving care and their family members. And so respect is about being responsive to and making decisions in partnership. So it is that co-creation, and that is in partnership with a person, a family, a caregiver, or in other instances, a community. We used to, in British Columbia, call this dimension acceptability. And the reflection and feedback that we were looking at this was that acceptability denotes sort of a good enough perspective. Also know that care providers, staff may experience injury themselves or burnout or vicarious trauma, and that emotional, psychological, and spiritual harm can be inflicted by limiting a person's autonomy or subjecting them to discrimination. So there are many aspects of safety, and so we have an expanded definition of safety for us that we are now aspiring to, that ensures not only physical safety, but cultural and psychological safety as well. And this really is, I think, one of the big fundamental shifts that we've had that is came from our Indigenous partners, but also bore through in the evidence around what drives quality. The next dimension is accessibility. And this is a long-standing definition. Access is often the one that our politicians spend a lot of time on, which is really, the ease at which health and wellness services are reached. So we know wait times is a big target in advancing quality. So it's really the extent to which people can receive care where and when they need it. But